I couldn't eat. I was having a lot of pain. I told clearly the doctors, I don't want to see my daughter. I just grew up with that idea. I'm going to become a doctor. I'm going to become a doctor. Nothing else about it. Forget everything I have done in my life. She is the reason I became Nooreen today. She changed my life, my whole life. Whatever issues I pass through, I keep reminding myself, you are here to help people. I'm an action woman and I can't stop at one stage.
Dr. Nooreen Al Balushi is a liver transplant surgeon, consultant, and the president of Oman Transplant Society. In this episode, we spoke about her childhood, her time when she joined the medical school, and then also the time when she had to deal with her own daughter requiring a liver transplant surgery. This is a very unique and inspiring story. Do not miss out on this one. All right, before we kick off with this episode, you can do me the small favor and subscribe to this channel. I'll highly appreciate it, and it'll help me bring you more and more high performers to this show. This is the High Performance Mindset, and today's guest is Dr. Nooreen Al Balushi. Enjoy this episode. Dr. Nooreen, welcome to the show.
Hi Hisham.
First question would be, mashallah, you're very driven. You've achieved a lot at an early age. You're a consultant, surgeon. What's your biggest fear?
My biggest fear is that something might happen and I can't proceed. Because I'm a person who's very active, unstoppable, and I'm an action woman, and I love a life full of challenges, and I can't stop at one stage. And I can't accept the fact that there would be something obstructing any road. So I guess that is my biggest fear.
So my next question would be, how do you look at, or what does adaptation mean to you?
Adaptation, basically, it's coping with everything. Our life is, it's up and down, when it comes to my field, to medicine, then, we are dealing with different people, with different diseases, with different mentalities every day. You are not seeing the same. The same disease might be quite differently manifested in two people, okay, within the same age, because this person might have a different personality than the other person. So we try to cope with every personality that we deal with. We try to cope with everything we are facing when it comes to our specialty, how we can perform, to our maximum and our best. And so I used to cope by, sometimes I change the way I deal with people. Sometimes I keep quiet and move forward. Sometimes I used to be kind, okay, and I'm still kind, but sometimes I might manifest anger in a bad way, but soon I would just relax and try to, think. The more I become more mature, the more I become more kind of silent, patient person who's trying to cope with everything. So coping is part of our maturity, and it's part of our, whenever we fail, then we start to cope as well, because, failure teaches us a lot of stuff. So that is the way we cope as well. And I do cope as well by having, a lot of supportive and, people around me, like my family and my friends who are my backbone as well. So I always try to have a coping mechanism of whatever I face. So I guess that is my definition of coping.
Yeah. Absolutely. I mean, even when you're, I think with every challenge, adaptation is paramount. Yes. Otherwise, if you're just trying to apply one way,
yes,
you're very limited.
Yes, you are very limited. So sometimes we do cope in a hard way, so by just moving on and just, holding ourselves. Sometimes we do cope by, changing the strategy we are following, just to make sure that stuff are moving forward. Because at the end, we think always about the other person we're dealing with, If it was the patient, then it's the priority of the patient, we think about the patient. If it was family, then, you think that they are first. So you need to cope with them as well. So
I'll come back to this point.
Yeah.
But now I want to go back to your childhood.
Okay. Mm-hmm.
You grew up with just one brother?
One brother, yes. I do have one brother, no sisters. Yeah.
Usually it's either your best friends or it's like cat and dog.
We used to be cat and dog, yeah. We are just two, so we used to be cat and dog. I'm the oldest, and he's just 2 years, younger.
Oh, that's very close.
Yeah, that's very close. So we used to be cat and dog when we were when we were kids, But later on, when we're grown up, so everything is nice and, bread and butter now. Yeah.
So how, let's say from age 7 to 12, right? What would your routine look like after school on a weekday?
I was so nerdy. I used to be really like a bookworm, so I was so nerdy, concentrating on my study, and but I used to get a break, during the weekend. I remember every Thursday we used, to go to my auntie's house, the family house, and enjoy that day beautifully. Then back again to study by Friday early morning. So really, that was my kind of routine during the school days, basically.
So let's say you get back from school, let's say 3 or 4?
Yes.
Let's say.
Yeah.
And then?
3 or 4. We used to come, I was in governmental school, so we used to come at, 12 or 1 o'clock. Yeah. So I just sleep.
Yes. Government school, we used to come back early.
Yes,
that's the nice part.
Yes, that is the best thing, basically. So we used to nap, After napping, then, I'll just start, studying, basically.
And what was your... Did you have a particular style of studying, or why I say particular style? Because maybe as a child I didn't have like any preference, but when I was late teenager or something, I would switch on the radio, the FM, and have it playing while I'm doing, let's say, my homework or doing my math.
Yes.
And then my dad, Allah yarhamah, would open the door and he'd be like, in Swahili, he'd tell me, he'd tell me, unasoma unacheza, like basically he's saying, are you studying or are you playing?
Yeah.
And then I would put it off.
Yeah.
But then I can't concentrate.
Yes. Okay.
And I didn't realize that was my way until I did when I was doing my MBA, and I had my assignments, and I would play some jazz, and then I would concentrate, and I can go for hours. But if it's just completely silent, 10 minutes and my mind is like somewhere else. And doesn't want to come back. So going back to you now.
Yeah. You see, I was just nerdy because I was determined and I had a goal, to achieve from the school. And my mother was a teacher as well. She was at the same school. So, for me, it was not only me.
Pressure.
It was a pressure as well because I am the daughter of a very famous, strict teacher who was in the school. So that's why... it was kind of a pressure on me, basically. I do remember my mom. She was, she was teaching me during my 6th grade, and it was a lot of pressure. I told her, "Why you are teaching me, and why did you choose my class?" She said, "No, I was forced by the people, to take your class. It was like 2 classes, 6th grade, they were there, so I had to teach you because I'm teaching the other class." So I'm like, okay. And I do remember the pressure while my mom is teaching me during she's a math teacher. It was high pressure, you know. She's a math teacher. So whenever, like, we're ending the session, she would ask the people to come and answer on the board. And usually she would choose the people who are, you know, who didn't score high, who didn't come at the beginning, you know, to, you know, correct their paper. So whenever I don't go as a first person to, you know, correct my paper, then she would ask me to go and answer the thing in the, you know, in the board. So that was so, you know, I can't remember this moment until now. So you know how
I'm sure, but even with the other students, what were they saying?
They were, you know, they were like, you know, because I used to be for 6 years before that grade. I used to be very good at school, so they were like nice. I was a nice, you know, like kid, and my childhood.
I would be also if my mom was in the.
I was really, you know, like even like I got a flip in my personality. I was very shy at school, but at the same time I was engaged in a lot of activities. I used, you know, to get engaged in most of the activities at the school. That's why I can't hold myself being quiet, you know, at one place. I always keep myself busy, even not by work, by always something else. So being nerdy at school is something, and then getting engaged in the activities. And I used to be the student representative for 12 years at school. Not even school, even university for 7 years, medical school. I was the student representative. So you can imagine how much
But whose idea was that?
It's selection. People select me. Okay, so people used to select me during the school.
So let's say in school, which class was the first time you
I became representative? It was, I guess, the 4th grade. I don't recall my first, second, third. I don't recall them very well. So I don't know whether at that stage there was a school, you know, like a student representative of that class. But I do recall it from 4th grade. Yeah.
What was it like? Let's say that's your first time.
Yes.
What was it like?
I don't remember, really. I don't remember, but I do remember I was always nice, doing activities, farewells by the end of the year, you know. Those are kind of stuff that we were engaged with when we were students at school.
Would you say you were more of an extrovert when you were a child?
Don't know how to answer that. I don't know how to answer that, but maybe yes, maybe no. Yeah, but it was quite different, you know, being representative in school rather than the university. University is different, and the school is different, because school you are not engaged in solving people's issues or the other students' issues. You're just there just to make sure that everything is running nicely. There's, you know, some activities running at the class and some farewells, that's it. But at the university, it was quite different, because you're solving issues. You're solving a lot of issues when it comes to exam timing, teachers who are not, you know, some lecturers who were not satisfied with, or some other stuff, you know, running, you know, during the university. So it was quite different. There was a different type of maturity here and a different type of maturity here, yeah.
I think what I noticed, even I had another guest, Saif Al-Minji from Kid City.
Mm-hmm.
His mom was also a teacher.
Mm-hmm.
And I noticed the people who one of their parents is a teacher, at least in school, they're more comfortable, you know, interacting in school, and, you know, at least for me, it wasn't the case.
It wasn't the case for me, too. Like, in front of my mom, I feel like, you know, like I'm just, you know, muted and silent. I can't do anything, you know. She was a very strict teacher, you know, at school, but she was an excellent math teacher, yeah, she was.
Do you remember your role models, whether it was on TV, whether a cartoon, whether an actual person growing up? Who did you look up to, or you feel
Yes.
influenced you?
My teachers, certain like teachers during during childhood, they really affected me. The way they were, their attitude, their behavior, their social communication, the way they approached me, they encouraged me. I always saw them as the role model, and I always wanted to please them, by being the smartest kid there. So they were my role model. When it comes to family, I guess my mother was my biggest role model. She was and she is still. She's like the sweetest person in the family. She's a leader. She's very tough woman. She's very kind, and she thinks about every single person in the family. And I guess I got that trait from her, basically. She's a problem solver. Everybody comes to her, It's like, that one person in the family who's everybody goes to her, just, to consult her and take her opinion. She's that kind of people who is there in every house, basically, in the family. So she is my role model, yes.
And did you know what you wanted to become when you were a child, or did it happen only when you were a teenager?
At our stage, جيل الثمانينات, we always thought about, being doctors, the best score that we can score is just, just go to medical school or teacher. The other thing I've never thought about engineering or something else. I thought about doing medicine. I thought mostly about going abroad, but then because of my family being the only daughter, they were so emotional when I told them that I want to go abroad. Then I'm like, okay, I'm going to stay here and continue here. So, yeah.
All right, then, okay, so let's say when did you know you're going to take medicine? Or at what age did you decide I want to take medicine?
Since the beginning. I guess it was an idea maybe put toward my mind from my dad or mom, and then I just grew up with that idea. I'm going to become a doctor. Nothing else about it. Yeah. And then my cousin was the first person to become a doctor in the family. He's like maybe 6 years older. Okay. And yeah. So he started. Then my other cousin, she went into medical school as well. So I just followed their path. Yeah.
And when you got to uni, which is here, Paramount,
yes.
Straight away, you went to become student rep, or it happened?
It happened out of sudden. I was doing my foundation, and I had a very nice group of, girls there. And, I'm very social. So I just made a group of 10 girls there, and we were always together. And I do remember...
There was no WhatsApp groups at that time.
No, there was no WhatsApp. I'm talking about 2001 in university. So I went and I spoke to... it was just out of sudden. The secretary was there. We were asking him about some logistics stuff, about registration of certain, subjects. And he was like, girls, we're choosing the student representative. Are you, do you want to select somebody? And then my friends, they say, Nooreen. And then he was like, yeah, okay, Nooreen, then Nooreen. Like, oh my God. So when I became the student representative the first year, then it just followed, it just continued that way. So.
And you didn't feel like it would take away from your study time or from...
Not really. I told you, I've always engaged myself in some sort of activity, and I became the opposite when I went to the university. I was a bookworm at the school, but I wasn't the bookworm when I became in College of Medicine. So I used to score good B plus, but not the person who's in A-list, until I went into the clinical practice. Because my mindset is always with the clinical practice, correlating stuff, knowing the patient, communicating with him. Then I flied and shine there in those clinical years, because I thought that is my thing, not just studying everything and every medication and every microbe there in the book. But when I became the clinical years, yes, I loved the clinical years, being at the actual hospitals rather than the classes, with the books. At that stage, I loved medicine more. And I loved surgery since I was fifth year medical student. It was the first rotation I encountered as a clinical practice, and I was just fascinated by it. I was just fascinated by the surgeons who are there. I was just fascinated by the results, the action, people who are dealing with acute cases. You deal with the patient today, and after 2 days, he's leaving the hospital in a good shape, saying, thank you for securing my life, So, and then I went through different rotations, like medicine, pediatric, and obs-gynae. I loved certain rotations. I did well in all of them, but I found myself more in surgery. And even in surgery, I found myself more loving to study about, gallbladder, about liver, about the pancreas, more than, the appendix and the colon and other stuff. So even at that stage, very early, before graduating from medical school, I loved that specialty and I kept it in my mind. I loved reading around it and about it. I don't know why, it just happened. Yeah.
And when you decided, okay, now this is where I want to shine, and you wanted to, push the gears.
Yes.
What did you change in your routine, let's say, to score better?
Yeah. So what did I change? I was more determined. I became more focused. Okay. I was, yes, busy as a student representative, but I used to. It's been like 5 years practicing that role. So I've used to all the problem solving and stuff like that. So I was more focused on my rotations, on scoring high, because this is the time where I'm going to graduate and go to hospitals and deal with, real patients and do the real life of a doctor. So that was my thing during the medical school. But after medical school, of course, I was determined because of the role models I have faced in surgical program. So many inspiring role models who are there.
How did they inspire you?
They inspired me. There were, new surgeons who came to Oman, and they were Omanis, because at that stage we had not many, Omani surgeons. So I was really inspired by these people who came from Canada. They were so determined. They were so nice to the students, to their colleagues, to the patients. We have seen the difference. We've seen the difference between them and between the others. So I was really inspired by them. And they were inspired by the good people and by the good students as well. So they encouraged us. They were like, no, you will come to surgery, And I kept it in my mind, during that stage. So when I became intern, that was my, determination to, do surgery in a very good center, because during internship we have to do like surgery, medicine, and then choose another specialty. So I made sure that my surgical rotation, it's not in a peripheral hospital, it's in the center. So I would just, decide about, will I move into this program or not? Then, dealing with the patients, being good, representing myself very well, representing the patients in a very good way. So the people were impressed, and they were like, you will enter the surgical program. Then I'm like, yeah, sure, I will enter the surgical program. So I did.
And it was already in your head.
It was already in my head, yeah. Even when I entered, they asked me even before entering, what do you want? I'm like, I want hepatobiliary. Hepatobiliary, it means, doing liver, pancreas specialty. So I'm like, I want that specialty. They were like, okay, we'll change your mind. Some of the surgeons, they were like, no, we'll change your mind. You will go to another specialty. I'm like, we'll see. So yeah, that happened during that stage. Then the other, chapter of my life, when I finished the internship and I went to the surgical specialty, I had my daughter, and it was in the first couple of months during my residency program, my surgical residency program. It was almost like the second or third month. So at that stage, my daughter was sick. After birth, she developed, jaundice, we thought at the beginning it might be physiological jaundice or breastfeeding jaundice or whatever. So
What is jaundice?
so jaundice is like a yellowish discoloration of the eyes, and the skin everywhere. So, a lot of babies, they do have that condition, after delivery, but then they improve with the phototherapy and everything else. And she didn't improve. Like 40 days passed and she didn't improve. Then I thought, no, something serious is going on. And I took her to the specialist and he said, yes, there's something wrong with your daughter and we'll follow for a couple of months. So we did follow for a couple of months and then we saw, no, everything is kind of, going down, and she was more yellowish. She became more kind of, sick. She was very beautiful girl when she was born, and then she became very pale, very, sick. I can see her dying in my hands. Although she didn't put me through a tough time, she was going through that tough time, but she didn't keep me, busy from my work or from anything else. I felt really, sad and upset. She's my only daughter, and at that stage, I'm like, oh God, yeah, is it this bala, يعني ابتلاء? Is it this ibtila that I'm getting with the same specialty that I want, it's the liver, it's all about the liver, So, so with the help of some certain surgeons around, they just encouraged me, to look for the best centers and get her treated. There's something called liver transplant. I've never in my life heard about liver transplant, not during my school. We have heard about kidney transplant, at that stage, but never about liver transplant because it was something new, started by 1960s. So, and there wasn't any, any facility in Oman, liver transplant. There wasn't anybody performing that. So we've never heard about it. And then they encouraged me. They said, go on, just do it, and your daughter will be fine. Then I started reading about it, and I found, conflicting stuff in the internet. Still, I was very worried. And then I asked about people who are going to China to get these, transplants done. And then I heard that this is like a difficult task because I've heard that no country will give their livers for free, So I'm like, okay, what shall I do? Then they say there's something called living donation. So what is living donation? They told me you can give your child part of your liver. Then I'm like, okay, I'm going to do that. So my family were shocked at that stage. They were like, no, what you're doing? I'm like, yes, I'm going to give my daughter part of my liver. If this is a very safe surgery, and according to the literature, it's very safe, then I'm just going to do it. And my mom and my dad, they couldn't say anything much at that stage. They were so, affected because it's their grandkid, So I'm their only daughter, and this is the first kid in the family. So they went with the wave with me. They were like, okay, whatever you decide for, we know that you're a doctor and you can decide for yourself. And but the rest of my family, they were like against it. They were like, you can have other normal kids. Why you are concerned about this kid? I'm like, what? She's part of me. What you're saying? And then I went for the surgery, and the surgery went very well. It was the toughest moment in my life ever. Those 2 months, it was tough on me more than the time when she was sick before the surgery.
What were the thoughts going through your head?
It was, what's going to happen to her? And one of my biggest fear was that
losing her.
That I'm going to lose her, So, because I know nothing about it, really real. That was the reality at that time. I knew nothing about liver transplant. So, passing through a lot of, moments that I've never seen in my life. I saw my dad for the first time ever in my life crying and crushing before I go to the operating theater. I remember I just, I just braided my hair and I came out just to make them laugh. I always pretended during those 5 months before my daughter gets her surgery that I'm really good, I'm really fine, I'm superwoman, I'm strong. Why you are concerned, guys? We will go through it nicely. But deep inside, I was very, scared. I was very scared just what will happen next.
And how were you dealing with those fears?
Nothing. I just kept quiet. I just pretended that I'm very good and I'm very strong in front of my family because I didn't want anybody to crush at that time and say, don't go for it. So I just pretended that I am strong, I am powerful, and I'm going to go through this. I went through this life very easily and I fulfilled all my dreams. Then why this thing won't happen? Like I've never faced such an issue in my life, so it was my kind of is it the first failure? I don't know. How did I consider it at that stage? But I just went through it. And, it's like the mother-kid bond and relationship, So I was waiting for that kid. And when she came, it's a message from God. So I just need to follow the path and see what happens. And I do remember I came and I started, joke about it. And I started hugging my mom and then my dad. And my dad crushed at that time. He started crying. And it was my first time ever I cry in front of them before going to operating theater. And I told them, take care of my kid. And I'm just going. We usually take the donor before the recipient, the receiving person. So I went there and I had the surgery. And I heard a lot of stories from my mom later on that your dad, fainted and the whole people came and then they gave him medication. He slept throughout and then they came after your surgery just to wake him up and tell him your daughter is fine. And he came to the ICU to see me. So those moments, I can't forget them, And I do remember the first days with my daughter in ICU. I was very strong, and then after surgery, I just became a different woman. I just became, that very weak person who's now waiting for the results, what will happen. So my daughter was in ICU, and I was having a lot of pain. I don't know whether I developed inflammation in the pancreas at that stage, but I remember losing 9 kgs in 2 weeks. So I couldn't eat. I was having a lot of pain. And I told clearly the doctors, I don't want to see my daughter the first couple of days. And they thought maybe I'm staying more in the ICU because I want to see my daughter. And I told them clearly, I don't want to see my daughter with all the tubes in and out, So I do recall the physiotherapist moving me around, and he took me to my daughter's room. And when I saw her, I fainted. I didn't know that was my daughter. And when I saw her, I fainted there. And I told them, don't show me my daughter. I don't want to see my daughter with all the tubes.
And why didn't they listen?
They thought that I'm having that pain and pretending. I wasn't pretending. I am a doctor. I'm telling you, I'm having a lot of pain. And I think at that stage I had, going back retrospectively, I had an inflammation in my pancreas. So that's why I couldn't eat even. So, and I told them, you can't see your kid with all different tubes going here and there and, tubes everywhere in her neck, in her tubes for urine, from the abdomen, from, her nose, everywhere. So that was, those moments were the most, miserable moments I had in my life. I do remember when they brought her to the room after a week. I see her for the first time. I started crying. My mom was trying to push me into the room, and I'm like, I can't see her. And then she pushed me. She said, no, she needs you. She needs, breastfeeding. And I'm like, no, my mom, she will not know me. And she's like, how she will not know you? It's been a week only. Like, no, she will not remember me. And I'm like, and my mother got me and she let me sit there. And then I'm like, who's she? And I couldn't recognize my daughter. She was really, she was dying in my hand, very sick, very pale. And then I see another different person who's chubby, very fair, giving her a lot of steroids, immunosuppression. So she was very puffy. And I'm like, is she my daughter? They were like, yes, she is your daughter. So at that moment, I just got her and I started crying. That moment was very, So that moment, I can say it just changed my whole life and my whole career and my whole perception of everything. If this girl made it through 9 months like that, and then through 5 months, 9 months of pregnancy, I mean, and then even during pregnancy, I had a lot of issues. And if she made it through those 9 months.
She already had the issue even during...
I had issues. I had issues with her, like spotting during pregnancy, getting a lot of leaves just to relax. You're going to lose your baby. But they never discovered that she got... They can't discover such a disease just by scans.
She was already facing...
Yes, I was facing a lot of issues during pregnancy. Then I'm like, I kept in my mind, if this girl, she was holding herself very well. She didn't cause anything to me during the 5 months when she was dying, even. She was just facing it all by herself. And I do recall the surgeon who came to me after her surgery saying, I've never seen a child who's fighting with the tubes the first day after surgery just to get extubated from the tubes. So, all those things clicking in my mind, how this child was very strong. She was the reason of the whole strength, and the whole change in my life, my perception, my personality. I just got changed since then, I became unstoppable. I became so determined. And it was I considered it a kind of an eye-opener, a message from God that this is the specialty that you have to take. So I was determined at that stage, oh no, it's not only specialty doing liver surgery, no, it's liver transplant as well. So I was determined since I was an R1 surgical resident. Everybody asked me, what do you want? I want this. And then everybody laughed about it because they know that I passed through this with my daughter. They know that this was my inspiration. So they encouraged me and they were so supportive. My seniors, my colleagues, everybody was just, even my family, I told them I want to do this. So they were happy about it because they have noticed the result, My daughter became very beautiful, smart kid, living her life, up and down like any other kid. She's very smart, smarter than her mother. She's so beautiful, and she's my strength. She's purely, I can say, forget the traits, forget the genes, forget everything I have done in my life. She is the reason I became Nooreen today. Like, she changed my life, my whole life, and my whole career. And going 13 years back, so she's now 13 years old. Going 13 years back when she had that surgery at that time, just now, after, going through this very tough specialty, being a woman and a surgeon, and going through all, fellowships I have done, the surgical residency program, and going abroad, not sleeping day and night, doing transplants, moving here and there with the helicopters, bringing organs. So I can realize that it was meant, and it was meant for this reason, that I became today a person who is helping my country to establish this program along with my other colleagues, who's here to inspire the people and to do something, because I do believe we are here to do something, not to sit at home only, My mom is now tired. She keeps telling me, you should sit home and pray to God and fast. And I'm like, yes, we do all of that, but God, created us not to do that only, but to give back, and to do something. It was a very tough journey, whatever I had, but it was an eye opener to me, an inspiration, basically. Yeah.
Wow, mashallah.
Yeah, I don't know how you would include that in the podcast, this whole story, but I've passed through all of this, but whatever issues I pass through and whatever problems, I pass through and struggles, I keep reminding myself, you are here for this reason, and you are here to help people, and you are here for this job, and you are here determined to help the other people and to help the other families. The way I was inspired, the way I got my daughter back to life, and my whole family, they were back to life. It wasn't her only, it was me, it was my mom, my dad, the whole family around. So everyone was back to life by her life. So transplant, having people with organ failure, it's not something easy. It's a disease to the whole family. Like the whole family, they are trying to cope with that person, and they are feeling really bad. So you're not changing the life of that person only, you're changing the whole family's vibe. So I do feel it. I did felt it. And I do encourage always my people when they come to me to the clinic, especially the parents, when they want to transplant, have a transplant done to their kids. I do tell them my story when I see that they are, like a bit reluctant. I do tell them, by the way, yes, I am the surgeon, and I had my daughter who had that transplant. And then, you can see their eyes, shining that, did that happen? I'm like, yes, you can ask me any question. Yes, you would say at this stage you will never touch your kid after transplant, but at certain age you will start being angry and shout and maybe hit her. So yes, life keeps passing
but
on.
For you, after doing the surgery, did it cause you any complication or?
No, it went beautifully. Alhamdulillah, it went really beautifully, and even. At that time, they were doing open surgeries. Now, for parents, for a very small liver volume, they are doing it laparoscopic and robotic, So you're talking about, 13 years. There is a great improvement in the field of medicine. Everything is being done now with very small incisions, laparoscopic or robotic. So, and we want to move with that, with that wave as well. We were trained in Canada to do robotic and laparoscopic, but we're waiting here to just perform it. So yeah.
So during doing your med school, did you go through a burnout?